As a doctor who has spent years observing and assisting seniors through various medical evaluations, I have noticed a consistent pattern. Many older adults unknowingly make several simple but critical mistakes before undergoing blood tests. These mistakes may seem harmless, but they can significantly alter results, leading to unnecessary worry, incorrect diagnoses, or even misguided treatment. Today, I'd like to address 10 of the most common errors seniors make before their blood work, explain why they matter, and share practical steps to help you get the most accurate and meaningful test results possible. The first mistake many seniors make is not following fasting instructions properly. Some blood tests, like lipid profiles or glucose assessments, require fasting for 8 to 12 hours. However, many patients either forget and eat a light snack, or, on the other hand, fast for far too long, thinking that longer is better. Both are incorrect. Eating even a small piece of fruit can raise blood sugar and triglyceride levels, while excessive fasting can cause dehydration and faintness, especially in older adults. The correct approach is to follow your doctor's exact instructions. Usually a simple overnight fast, no food, only water, is ideal. Remember, even coffee or tea in the morning, particularly with sugar or milk, can influence your results. The second common mistake is taking regular medications or supplements right before a fasting blood draw, without checking whether they should be paused. Seniors often take multiple medications, antihypertensives, cholesterol pills, blood thinners, or vitamin supplements, and some can interfere with test accuracy. For instance, biotin, a popular supplement for hair and nails, can distort thyroid and cardiac test readings. Similarly, certain painkillers and steroids can elevate liver enzymes, mimicking disease. It's crucial to clarify with your physician which medicines you should take as usual and which to postpone until after the test. Never stop any prescribed medication on your own. Always consult your doctor or lab personnel before the test. The third mistake is not staying hydrated. Many seniors come in dehydrated because they think fasting means no water. This is a misconception. Proper hydration keeps your veins plump and easier to access for blood collection. Dehydration thickens your blood and can lead to falsely elevated readings, particularly for creatinine and blood urea nitrogen, which measure kidney function. To avoid this, drink small sips of plain water before the test, unless your doctor has specifically restricted fluids. A hydrated body not only helps with accurate readings, but also reduces discomfort during venipuncture. Mistake number 4 is engaging in strenuous exercise or physical activity before the test. Some seniors go for an early morning walk, do yoga, or perform light chores thinking it will get the blood flowing. While staying active is commendable, intense activity can temporarily alter levels of enzymes like creatine kinase, lactate dehydrogenase, or even blood sugar. These changes can mimic disease or cause unnecessary alarm. Therefore, on the day of your test, it's best to keep physical activity minimal and rest adequately before heading to the lab. The fifth mistake is consuming alcohol or caffeine the day before testing. Alcohol can dehydrate the body, affect liver function tests, and distort glucose readings. Caffeine, on the other hand, can raise stress hormones, slightly alter cholesterol levels, and increase blood pressure. Seniors with cardiovascular or metabolic conditions should be especially cautious. A general rule is to avoid both alcohol and caffeinated drinks for at least 24 hours before your blood test. Instead, opt for water or herbal tea. The sixth mistake is not getting enough sleep the night before. A restless night, anxiety, or even staying up late watching television can cause stress hormones like cortisol to spike. This can UN's glucose and lipid readings. Seniors often underestimate the impact of poor sleep on the body's biochemistry. Aim for 7-8 hours of restful sleep before your appointment. A calm, rested body yields more stable, reliable results. Another frequent oversight is scheduling blood tests at inconsistent times. Blood chemistry fluctuates naturally throughout the day due to circadian rhythms. For instance, cortisol levels are highest in the morning, while certain lipids and hormones vary at midday or evening. Seniors should ideally take blood tests around the same time of day each visit, typically early morning, to ensure consistency when comparing results. This helps doctors track trends more accurately over time. The eighth mistake many seniors make is wearing tight or restrictive clothing that hampers proper blood flow during collection. Sleeves that are difficult to roll up, or garments that constrict circulation make it harder for the phlebotomist to locate a good vein and can cause bruising or discomfort. Choose loose, comfortable clothing that allows easy access to your arm. This may sound trivial, but comfort and practicality during testing matter more than you think. The ninth common mistake is feeling anxious or stressed before the test. Anxiety can cause the body to release adrenaline and cortisol, which may transiently increase blood pressure, blood sugar, and even white cell counts. Seniors often worry excessively about the pain or potential results, unknowingly influencing their readings. Deep breathing, relaxation techniques, or a calm conversation with the nurse can help ease nerves. Remember, these tests are designed to help, not to harm or frighten you. Finally, the 10th and perhaps most overlooked mistake is not informing the healthcare provider about recent illnesses, vaccinations, or medical procedures. A recent infection, even a mild cold, can temporarily alter white blood cell counts, liver enzymes, or inflammation markers. Similarly, vaccines can trigger immune responses that skew certain lab values. Always inform your doctor of any recent health events, even minor ones. This context allows them to interpret your results correctly and avoid false alarms. In summary, the first half of our discussion highlights how seemingly small actions, like skipping water, taking the wrong supplement, or losing sleep, can significantly distort your test outcomes. Blood tests are powerful diagnostic tools, but only when handled with precision and care. Seniors in particular must be extra vigilant, as their metabolism, hydration, and medication interactions are more complex than those of younger adults. Following simple pretest guidelines can ensure that your results truly reflect your health status, allowing your doctor to make the most informed and effective decisions for your care. Now, let us discuss why these mistakes occur so frequently among seniors and how to prevent them with practical strategies that anyone can follow. The human body becomes more sensitive with age, metabolism slows down, medications accumulate, and small lifestyle choices produce bigger effects. Many older patients simply follow habits they developed decades ago, unaware that their physiology has changed. My goal today is not only to correct these misunderstandings, but to empower you with knowledge, so you can prepare for blood tests confidently and accurately. First and foremost, communication with your healthcare team is your strongest tool. Many seniors hesitate to ask questions, either because they feel rushed during appointments or because they don't want to bother their doctors. Please understand, your doctor wants you to ask questions. If you are unsure whether to fast, take a certain pill, or drink water, clarify in advance. Bring a written list of your medications and supplements each time you visit the lab. This ensures the medical staff can identify possible interferences. Transparency leads to better outcomes. Planning your test day also helps immensely. For example, schedule morning appointments to align with fasting guidelines and natural hormone cycles. Avoid planning strenuous activities afterward in case you feel lightheaded or tired. Bring a small snack, like a banana or whole grain crackers, to eat immediately after your blood is drawn, especially if you are diabetic or prone to dizziness. These small steps can make your experience safer and smoother. Managing anxiety is another essential step. Seniors often develop test-related fear after previous painful or unpleasant experiences. Modern laboratories, however, use thinner needles and advanced techniques to minimize discomfort. Practicing deep breathing, meditating briefly before the procedure, or even chatting with a friend can lower anxiety levels. Remember, your mindset influences your body chemistry. Calmness contributes to steadier readings. Hydration remains key, and I cannot emphasize this enough. A well-hydrated body ensures better circulation and easier blood collection. If you tend to forget water, set a reminder the night before. Drink 1 or 2 glasses upon waking, unless medically restricted. Avoid sugary drinks or juices, they break your fast. Only pure water is allowed. Another point worth addressing is diet in the days leading up to your test. While fasting matters most during the final 8 to 12 hours, your dietary habits 2 to 3 days before also influence lipid and glucose levels. Avoid heavy, greasy meals and excessive salt, which can inflate cholesterol or electrolyte readings. Try to eat balanced meals, rich in vegetables, lean protein, and fiber before your test day. Medication awareness cannot be overstated. If you're on blood thinners like warfarin, cholesterol drugs, thyroid medication, or diabetic pills, timing is everything. Some medications are safe to take before the test, while others can temporarily distort results. For instance, diuretics may raise uric acid levels, while corticosteroids affect glucose. Always follow your doctor's tailored advice rather than general internet suggestions. Let's also address the role of recent illnesses and vaccinations. Seniors often undergo periodic flu or pneumonia shots, and these can raise immune markers like CRP, C-reactive protein. If your test is meant to evaluate inflammation or immune function, it's best to wait at least a week or two after vaccination. Similarly, recovering from infections can temporarily alter liver and kidney tests. Inform your physician so they can interpret results accordingly. Another point often overlooked is lab variability. Different laboratories may use slightly different methods or machines, causing small variations in results. For consistent tracking, try to get your tests done at the same facility each time. This allows more reliable comparisons and trend analysis. Post-test care is equally important. Many seniors rush off after their blood is drawn, forgetting that sudden standing or walking can cause dizziness, especially if fasting. Sit for a few minutes, eat your prepared snack, and drink some water. If you notice bruising or swelling, apply gentle pressure or a cold pack. These steps may seem minor, but they enhance your comfort and safety. Now, beyond these 10 specific mistakes, there lies a broader principle: health literacy. Understanding why these tests are ordered and what they measure gives you power. Blood tests are not just numbers, they are a snapshot of how your organs, metabolism, and immune system are functioning at that very moment. When you prepare correctly, you're not just cooperating, you're participating actively in your health management. It's also helpful to maintain a small health diary, record test dates, fasting durations, any medications taken, and how you felt before the test. Over time, patterns emerge that both you and your doctor can analyze. This practice is especially useful for chronic conditions like diabetes, hypertension, or thyroid disorders. Lastly, I want to emphasize the importance of patience and perspective. Sometimes, even when all precautions are followed, results may still vary slightly. This doesn't always mean something is wrong. The human body is dynamic, constantly adjusting to diet, sleep, and stress. Your doctor interprets results in the context of your overall health, not isolated numbers. So, in conclusion, let me remind you of the key message: most pre-test mistakes are entirely preventable. By following clear instructions, fasting correctly, hydrating adequately, resting well, managing stress, and communicating openly, you can ensure your blood tests truly reflect your health. Think of these precautions as a partnership between you and your healthcare team. Accurate test results mean better diagnoses, fewer unnecessary procedures, and ultimately, better quality of life. Taking charge of these small details shows responsibility and respect for your own well-being. As your doctor, I can analyze your reports and recommend treatments, but only you can control how you prepare for those tests. Each responsible choice you make, each glass of water you drink, each medication you confirm, each night of restful sleep, contributes directly to better health outcomes. Remember, prevention is not just about avoiding disease, it's about creating the conditions for accuracy, trust, and peace of mind in every step of your medical care. Thank you. As we come to the conclusion of this discussion, I want to leave you with a simple but powerful truth. Good health depends not only on the medicines you take or the treatments you receive, but also on the small, consistent decisions you make every single day. The accuracy of your blood tests may seem like a technical issue, something that happens in a lab, far away from your control. But in reality, you have more influence over it than anyone else. The way you prepare your body, follow your doctor's advice, rest, hydrate, and maintain discipline before a test can make the difference between a confusing report and a crystal clear reflection of your true health. That is why awareness and preparation are not minor details. They are vital acts of self-care. Many of you here have gone through decades of experience, of triumphs and struggles with your health. You know that the body changes with time. Muscles may weaken, metabolism slows, memory shifts, but wisdom grows. It is that wisdom, combined with accurate medical data, that allows you to live well in your later years. When a blood test is done correctly, it becomes a roadmap that guides both you and your physician toward better choices, what to adjust in your diet, what treatments are effective, and what can be safely discontinued. But when a test is distorted by the mistakes we discussed, by dehydration, skipped fasting, or medication errors, that roadmap becomes blurred, and the journey toward good health becomes harder to navigate. Think of your body as a finely tuned instrument. For it to play harmoniously, every part must be in sync: your heart, your liver, your kidneys, your hormones, all communicating through the signals found in your blood. A blood test is like listening to that music with a sensitive ear. If you prepare properly, we hear every note clearly. But if there's interference, if you've eaten, missed sleep, or taken something that alters the result, the sound becomes distorted, and when that happens, even the most skilled doctor cannot interpret it perfectly. So, the quality of your preparation directly shapes the quality of our understanding. I want every senior to recognize that these precautions are not burdens, but blessings. Fasting for a few hours, drinking water, resting properly, these are not sacrifices. They are small investments in accuracy, safety, and peace of mind. You deserve medical results that truly represent you, not guesses, not confusion, not numbers clouded by preventable errors. When your tests are clear, your doctor can act with confidence. We can treat you efficiently, avoid unnecessary medications, and give you advice that's truly tailored to your condition. Let us also not forget the emotional side of healthcare. Many seniors live with anxiety before tests, fear of bad results, of needles, or of what the future may hold. It is natural to feel this way. But I want you to remember, a blood test is not your enemy, it is your ally. It doesn't exist to find what's wrong with you. It exists to help you understand what's happening inside your body, so you can take control early, before problems grow larger. Knowledge is not something to fear, it is something to embrace. And every time you prepare properly for your test, you are showing courage, the courage to face your health with clarity and honesty. In my years of practice, I've seen two kinds of patients: those who approach tests casually, and those who prepare with mindfulness. The difference in their outcomes is profound. The mindful patients, those who follow fasting rules, communicate clearly, manage stress, and stay consistent, end up with cleaner results, fewer unnecessary retests, and more effective treatment plans. They recover faster, spend less on avoidable procedures, and, most importantly, feel more confident in their care. Their relationship with their doctor becomes a partnership based on trust, accuracy, and respect. That is what I wish for every one of you. Now, I understand that memory sometimes fades, routines become harder, and managing medications can be overwhelming. That's perfectly all right. The solution is not perfection, it's preparation. Write things down, use reminders, or ask a family member to help. Keep a simple checklist on your fridge that says, no food after 10 p.m., water allowed, medicines confirmed, sleep well, stay calm. These little acts of planning are small keys that unlock better health. And for caregivers who may be listening, your role is priceless. Reminding your loved ones gently, offering them water, or calming their anxiety before a test makes a world of difference. The future of medicine is moving toward personalization, treatments tailored specifically to your unique body chemistry. But personalization only works if the data we collect is accurate. So, the responsibility lies with both the doctor and the patient. You prepare your body, and we interpret your results. Together, we ensure that every test, every number, every reading tells the truth. So, as you leave here today, I encourage you to view your next blood test not as a routine errand, but as an opportunity, a moment to participate actively in your own care. Follow the steps we discussed. Fast properly, drink water, rest, communicate openly, avoid unnecessary supplements or caffeine. Keep your body steady, calm, and ready. These may seem like small actions, but they have enormous impact. They reflect discipline, awareness, and respect for your own well-being. In the end, the goal of medicine is not just to extend life but to enrich it. To make every day more comfortable, more confident, and more independent. When your blood test results are accurate, we can help you live that way. So, let's promise each other this. No more preventable mistakes before blood tests. No more confusion or misinformation. From now on, every senior deserves to have the full benefit of precise, reliable, and meaningful results. Because your health, your peace of mind, and your dignity are worth that effort. Every single time. Thank you. And may you all continue to take charge of your health with wisdom, awareness, and confidence.